everyone, I'm Lenis. Today I'm going to show you some techniques how I can release, relax, and maybe do disappear the pain in people who have middle back, upper back, and neck pain. So I'm going to show that we can do massage and mobilizations without no oil. If the people one doesn't remove the clothes, we can work like that. It's okay. So I'm moving now the vertebral column to relax the nervous system and can go a little bit more deep. And my patient is not gonna feel too much pain today and the next days. Now we are gonna relax a little bit the fascia for the both sides, of course. Usually when person report, for example, if the people or person report pain in the right side, we have to start the mobilization and the techniques with the left side, always with the opposite side, because in this way the muscles of the opposite side relax and allow the muscle of the side that is tight to relax and move. That's good. Okay. So now we are going to do some mobilization for the scapula. I'm going to grab here, this is the scapula. I place my hand here on the shoulder and the other hand on the scapula. Move toward the ear and down. Now I'm going to press with my arm down and with the hand that is in the shoulder up. All this is to release the subscapular muscle because it's here under the scapula and it's a little bit more difficult to work because the bone is there. Pressure is okay? Yeah. That's good. Always we have to ask how is the pressure. It's very important. Very good. I'm gonna just go for the other side. Just to work here. Pressure points in this area. Moving the scapula out, especially here. We have a pressure point here. The lever of scapulae that is very, very tender. People who work in front of computers, people who have rounded shoulders, back posture. So we are going to spend a little bit in this side, in this tender point. Okay, now I'm going to move just here the shoulder, grab here, and I'm going to move again up and down from the shoulder and elbow. Okay, now I'm gonna lift here the muscle, the trap short. So pushing with my hip, the shoulder, grab here and I'm gonna press here. This is because I'm shortening here the muscle. When the muscle is short, it's gonna release faster. And it's gonna be less pain for the patient. Always we have to, 2 more minutes, much better. That's good. Now we are going to stretching. Very good. Again here. When I do this job here, I'm working here in the pecs as well. Stretching the pecs are really important to can release upper back as well. Just a little bit more move and more pressure here. Very good. We're gonna move now the arm and the shoulder. Now I'm gonna get here, stabilize here the scapula. I'm gonna move a little bit the shoulder here, just to increase the range of motion. Any scar tissue, muscle pain here is gonna relax. Now I'm gonna move the shoulder here, and really important to work in this point here as well, because here as well the attachment of the muscle that is under the scapula. Sometimes it's a little bit tender, so be careful, gentle, but then the patient is gonna feel very relaxed. Here is another tender point. Usually sometimes people complain because anterior pain here on the shoulder on the front side, and sometimes the trigger point is here, and we pressure here, we can release anterior side. So it's important to work both sides, anterior and posterior, and relax again. Very good. Always work in both sides, of course. Now I'm gonna work, get here, the up trap. This technique is for trigger points called C-bowing. So I'm gonna grab and go C-bowing down, moving here. Usually here, if I find the levator scapular trigger point, I'm gonna grab like a C and get here the muscle. Like that. As well, just pressure here down. Stay here 1-2 minutes, depends. Move. Now I'm gonna work here with another tender point here in the suboccipital here, and at the same time with the up trap, the attachment. So I'm gonna move here the suboccipital here, and the other hand in the traps. Move it down, help to relax. I can work here with the fascia as well, just grabbing here and moving like that. For work here in the fascia, if I wanna work here like that, I need just to move a little bit the clothes, because I need, work on the skin. But if I wanna grow in like that, and just moving like that, rolling, skin rolling, I don't need to work, directly on the skin. I can do like that. Always working the fascia have to be slow here, because we are teaching the technique. But everything that you can do in the massage and exercise is slow, much better. Less painful and better for the patient. Now we can work here on the neck. We can do a little bit more massage here to warm the place with oil or without the oil, and then I can move side to side the cervical here. Very, very gentle, not too much pressure, because it's the neck. We have to be gentle and nice. Okay, I can pressure here again. I can do the pressure here like that, 1-2 minutes, or I can as well here with my fingers, just skin like that, working on the fascia again, and in the tender points as well. I can place here the tender point pressure, and with the thumbs I can work in the rest of the head. Sometimes working in 2 or 3 points at the same time is better, because we try to, to distract the brain, and it's not too painful for the person. Like that. When we have, we find more tender points, we are gonna, stay more time in this area, working slow, no more than 3 minutes. Very good. Now I'm gonna just do some mobilization here to the side of the vertebral column, never on the top because we can broken the posterior hypophysis and it's very dangerous. So just lateral side. We can do vibration with the hands. We can work as well with pressure and vibration here, just like that. That's good. How you feel? Very good?
Yeah.
More relaxed. And always working in both sides, of course. Don't forget here because we are, showing the technique. But always is important work in both sides. For our client, we're gonna work just a little bit here to relax both sides. Usually when one side is relaxed, the other feel better. Sometimes don't need to spend too much time. Like that. Very good. And you can work a little bit more in the fascia. We can work after because it's very warm now, the tissue, so we can move more. When we work in the fascia, we work in the all the directions. Doesn't matter if it's up, the left, right to right. Doesn't matter. You can work in all the directions. Okay. So I hope so. The video will helpful for you to see how can help to others and to welcome to come here to the clinic if you need help to release these muscles. Thank you very much. Bye-bye.